Hi, my name is Kelly Rotondo. I am an assistant professor at Millersville University in Millersville, Pennsylvania. The topic of my poster is Filling the Gap for New Clinicians, Intro to Telehealth. Healthcare systems today are trying to settle down and regain a sense of normalcy of the pre-pandemic years. However, there are areas that will never return to the balance of the years before 2019. One of these areas being telehealth programs. Patients and families have been exposed to how technology and healthcare combined to allow care to be provided in many non-traditional locations. And will continue to demand these services. Healthcare is not perfect, nor has it ever been so. Educators and clinicians have worked tirelessly for years to combat poor quality care, inequities, medical errors, disparities, and low patient and family satisfaction. Telehealth is just one way to improve these areas and attempt to contain the cost of this not perfect system. After reviewing this poster, I hope that you will be able to describe the importance of including telehealth courses in undergraduate studies for future healthcare employees. And secondly, identify the key telehealth competencies that new clinicians should be exposed to during their undergraduate studies. Review the gaps in telehealth knowledge, skills, and attitudes within their organization. Telehealth usage exponentially increased during the pandemic. However, clinical programs, for the most part, are still not including it in their curriculums. The use of telehealth is being demanded by patients and families for many reasons, such as decreased costs associated with gas, mileage, and time off work, improving disparities in care, access to specialists in rural areas, and stronger patient-family satisfaction. Patients and families have reported the flexibility and ease of telehealth visits, especially with the chronically ill. A telehealth certificate program was created to support and develop telehealth competence for new clinicians, including nurses, social workers, dental assistants, respiratory therapists, and psychologists. The curriculum for this program is set up in 3 online asynchronized courses. The 3 courses are Telehealth Foundations, Telehealth Policy Advocacy and Clinical Application, and Advanced Telehealth. A tailored experiential learning experience called TELS are used to ensure that competencies are achieved. Examples of these TELS are such opportunities as interviews with leaders in the field, weekly readings of current websites and hot topics, reaching out to state and federal politicians and telemedicine organizations. Case studies, webinars, white papers, literature searches, grant writing practice, and quizzes focused on the power of reflection and the spirit of inquiry are just a few ways that this is to ensure telehealth competencies are achieved. The competence wheel is completed by each individual student at the end of the certificate. The goal of this poster was to ensure that undergraduate learners are well prepared to use telehealth technologies, identify telehealth competencies for new undergraduate clinicians, and increase their knowledge, skills, and attitudes with a direct connection to outcomes. The idea of creating an additional certificate program that counts towards free electives for students and enables them to build their academic resume has been very successful at one university and could easily be replicated in other universities and institutions. Successful implementation of telehealth competencies in undergraduate programs need to be included. Flexible, individualized learning pathways to guide the experience with telehealth concepts. Time for self-reflection and correlation to the real world, consistent coaching and feedback from professors and clinicians that have experience in the field, safe, tailored, experiential learning experiences. As you can see at the bottom of this poster, there is a picture that dictates and and visualizes the telehealth competency-based education model for telehealth that Millersville uses. At the left-hand side, you will see the typical traditional method, and there is a gap that has little to no telehealth included. Our goal is the green bar across the bottom here. Through telehealth foundations, telehealth policy, advocacy, and clinical application will then lead to advanced telehealth, will then give way to how we can keep our learners engaged in the real world and help them complete this competency wheel of skills, knowledge, attitudes, and outcomes. Thank you for your time today and listening to this poster. I can be reached at the bottom here at my kelly.rotondo@millersville.edu if you have any questions about this poster, and I'm happy to provide my references for the material. Thank you again for your time. Have a great day.